What's up everyone, Dr. Dan over here. We got Sarah in the house. Sarah is a tennis player. What? Amateur slash...
Just a competitive player.
Competitive player, right? Come around here to her back, right? So Sarah also has been dealing with a little bit of a scoliosis. And if we kind of look at her right versus left shoulder blade, you can see how her right shoulder blade is a little more elevated than her left, right? So Sarah is a right-handed tennis player, correct? And so she's doing a lot of swinging with the right hand, right? So forehand, backhand, always overusing. And we've been working with Sarah for a little bit to teach her how to swing a little lower, packed out of her lat, so she's not so neck dominant on the right side. Now she's had scoliosis. Scoliosis means curvature of her spine, and that's been forever, right?
Since I was like 14.
When she got told she had scoliosis. So scoliosis means curvature of the spine, and basically what happens in most cases as a kid, you might hurt your back and twist or strain a muscle in your back, and your whole body grows up like kind of crooked then. And a lot of people are told that scoliosis is not fixable. That's not true. It is fixable with good muscle work and chiropractic care and rehab exercises. So Sarah came to us only a couple months ago, and we've been working with her shoulder. We see you infrequently, once every couple months now, but we're gonna go through an adjustment, some muscle work to the shoulder. We're gonna use our new little Hypervolt, which is awesome. If you guys have a good chiropractor or physical therapist that you work with, this is an awesome tool. It's basically just a little massage gun. You'll see how I use it on her shoulder to help loosen up some of the tight muscles. And then we're gonna get her adjusted. That'll be our video for the day, all right? So before we start, well, I guess as we start, we're gonna start to work up in her neck and her right trap, which again, as a tennis player, every swing that she takes, we're trying to teach her to be mindful of swinging out of the lat, which we've talked about, right? So trying to kind of hit low so we're not hitting up into the neck, which if we do 1,000, how many hits do you do a year or a game, a match? I don't know, a lot, right? And if we swing 100 times or 200 times or 500 times up into the neck, we're gonna get a real big neck workout, and then we're gonna leave there and we're gonna feel like this, and things are gonna be sore and tight, right? So we're gonna go through, do a little muscle work. I'm going to pull this way, SCM muscles, the splenius capitis, some of the lateral neck muscles right here. We're going to do just some deep muscle work into the side of the neck where the upper trap attaches to, the levator scap muscles, and then again like the suboccipital muscles. And if you ever get like chronic, or not even chronic, but acute headaches, or just like those tension headaches, if you're sitting at your computer for a long period of time and you start to like feel like you're real tight and compressed in your neck, or you're real stiff in your neck, you might get some neck pain that can turn into headaches. Sit up tall for me. There we go. Look down, up, down, up, down, up, down, up, down, and down, whole way down. And we're going moderate to deep pressure in the back of her cervical region, suboccipital region, and she can handle some pretty deep pressure, and she comes in here to get worked out. Down. And you can feel right in there, which it actually is not too bad today, right?
Not too bad.
Not too bad, a little bad. Other times it's real jammed up. And so we're gonna do just about like 20, 30 passes down. We're gonna guide her when we say sit tall, right? We help to kind of just lift her head up and back to make her a little bit more posturally sound, so that we can just kind of, while she's in here, train her brain to say up and back. Gravity makes us get squished. Life makes us get squished. Kids make us get squished. Tennis makes us get squished. Computers, videos, video games. All right, now we're gonna work in like her right shoulder blade, levator scap and upper trap, right? We'll do a little work in her pec, and go ahead, get her adjusted today. Look up straight, down, up, down. And then again, I practice with a lot of like myofascial release, where we kind of pin the muscles, hold it, down, way down, up, down. We use a little lotion to help decrease friction around the skin, and it really helps us to kind of get deep down into those knotted up, funky muscle fibers that if you move your arms or your legs and you feel things clicking and popping and grinding, that's called crepitus, not a good thing. Look down, hold it, look up, look down, crepitus, look way down,
sorry.
Look up, look down. And if you see my hand right here, we're gonna up. Oh, we missed it right there, right here, right here, right here. It slips over that big thing. Feel that big thing in there? Down. So this little rhomboid fiber, up, down. You'll see my hand, watch my hand slip. Oh, up. And she's got a big, how's that feeling there?
Oh, fabulous.
Fabulous. Up, down. All right, sit up tall. And already that helped to loosen up the right shoulder a little bit, right? So a lot of times people will get like real, I say contracted, like your muscles get tight and it jams your joint up. And when your joints get jammed up, like your neck joint or your shoulder joint, your glenohumeral joint, where the shoulder meets the scapula, when things get jammed up, they don't feel good. And they start to grind and they wear and they tear. And over months and years of wear and tear, you end up with this bad word that doctors like to throw around. They say, you got arthritis. And then all of a sudden you think, I can't do the things I used to love to do because I got arthritis. And that's a bunch of baloney. Because if you stretch and you get all this muscle tension worked out, your joint, it will loosen up, right? And it will decompress and it will become healthy again. And we feel in Sarah's upper trap supraspinatus complex right here. Deep breath in, breath out. Lean this neck to the left. You feel that thing right in there. Mm-hmm. How's that feel? Like probably the opposite of Christmas, maybe.
It's not that bad.
Not that bad. Good. All right. So she's got a little lump right in here. Just a real old strain. So when you tear a muscle, and a muscle like strains, if you've ever kinked your neck or anything like that, you can get a muscle strain. Basically the muscle rips and your body will lay down all this fibrotic tissue in there and it hurts. Okay, so we got a new Hypervolt. This is an awesome little massage gun. It might be a little loud on the video, but we're gonna go on speed 2. And Sarah's never felt this before, so she might be a little jumpy. And what you're gonna do, you're gonna lower your shoulder down. And you're gonna work on squeezing that lat like we talked about. And I just want you to lean your head to the left a little bit. And this massage gun, just like in our clinic, if you've seen some of the other videos with like the Hyper Vibes, this is a form of vibration or percussion therapy. Okay, head straight down. Shoulders forward, like that. And this little vibration, just like a jackhammer breaks up concrete, helps to get in and promote blood flow in some of the deep and superficial musculature, as well as even promote some movement into the joints. So I've been using this a little bit more to kind of save my hands throughout the day. Lean your head to the left. Lower your right shoulder. Head straight down. Shoulders forward. And we can feel, you feel right in here, huh? So she's pretty restricted right in her mid-back. Shoulders forward. Round out your spine, so head down. Yep. And you can hear how the gun kind of makes a little sound. The sound changes. Basically, if the tissue, the connective tissue, the musculature, and the bone, if it's not absorbing the vibration, the gun starts to jump a little bit. Oh, Hear that sound right there? That's where we've got a little, that knot that we were just working on, or that fascial restriction, that myofascial restriction. Lean your head to the left. Now me as a chiropractor, right, I'm working on people all day long. So when I'm holding this thing, I'm trying to keep my shoulder back and down also, so I get this tension in my lat, and I'm not jamming up my own neck, causing my own problems just like she has in her neck. So being mindful in your movements, trying to keep tension in the lower arm and the tricep back in the lat. Cool, head up. We'll do a little scan on the left side. Look down. And this is going to help just prep her spine for this awesome thoracic adjustment we're about to do. Alright, cool. Let's go face down on the table for me, kid. Okay? Alright, so if we look, what a scoliosis is when we see that the right side's higher than the left side. So her spine is rotated like this, and basically her ribs are higher on this side, right? So we have given her some core work, some oblique work to work on to help develop symmetry in the core muscles, which will help to promote even movement throughout the rib cage. But for a long period of time, and with her past history of tennis playing a whole bunch and swinging the arm, that's part of the issue that's fueled the scoliosis, the curvature, right? So if you do an asymmetric sport, if you perform an asymmetric sport like tennis, where you're constantly only swinging right arm, you're gonna go, it's like going to the gym when you just work out one-sided all day long. It doesn't make sense, right? Okay, deep breath in, deep breath out, the whole way out. And we're gonna go nice and good. And let's put those arms right down. Breath in and exhale out, whole way out. Breath in, one more, and exhale out, whole way out. Yeah. Good, okay. Now, what happens with scoliosis, again, your body, it gets wrung like a towel. So imagine if you're like wringing a towel out. And so all this tension transfers over into the left side, and then she ends up with usually left glute imbalance. Bend your leg up here. Let those, just kick those off, okay? If you can.
Sorry.
That's all right. Boom. Okay. And so in addition to the muscle work in the right shoulder, we generally will do a little bit of release in the left hip. We're going to use that hypervolt on our lower back. And then we're going to give her some exercises to work on to help create some symmetry in between her upper body, lower body. And if you watch some of our other YouTube channels or videos, you'll see us use a lot of those RMT clubs, right? So the RMT clubs that you see Brian and myself using is a weighted club that helps us to develop symmetrical movements between the left arm and the right arm. So for a tennis player, it's a great tool to utilize to swing and practice training to develop symmetrical swing patterns, left side versus right side. All right. Stay right there. Boom. And we're going to kind of go through this. Might be a little ticklish, all right? We're going to go deep into the QL. Just deep breaths into your abdomen like we talked about. So, can you hear me on the video maybe? Okay. So if you're ever getting a massage or getting worked on, it's super important to focus on diaphragmatic breathing. Diaphragmatic breathing will help you to maintain a state of relaxation, which helps the muscles to relax much better and quicker, as opposed to what you want to try to do when you have a new sensation like right here, she might tighten up a little bit. So instantly we go back into thinking about our diaphragmatic breath, and you'll feel as you breathe diaphragmatically, that means in and out of your belly. Check out our other videos for that. You'll feel how your body will relax. So if you yourself are ever getting a massage or chiropractic work or hypervolt work or anything like that, work on belly breathing. It will help you a ton. A little ticklish in some spots, isn't it?
Yep.
Deep breath in. Hold it in. Good. Hold it in. Exhale out nice and slow. So when a muscle is tight, hypertonic, overactive, it becomes sensitive. Sometimes the sensitivity is felt as ticklish, and sometimes it's felt as pain. Either way, the nerve's messed up, the muscle's messed up, and we need to help calm it down. When a nerve and a muscle, they get overly sensitive, they're trying to tell you something. So, the other thing that we work a lot on is that spiral line of muscles, which maybe we can post a video or a picture of the spiral line of muscles, so you can see how some of the mid-back muscles spiral over to become the lateral leg muscles. And so again, right shoulder, left hip problems are very apparent. From a rehab perspective, we want to start to train the opposite sides, so left shoulder and right hip, with some bilateral movements like a bird dog, dead bug exercises to help core stability. Bridging is really good for developing symmetrical left and right hip movement. All right, cool. All right, in the hypervolt, what that does, it just helps us to get some of the muscles nice and loose, all right? Okay, so we're gonna go real easy in the shoulder here. Good. And one more on the left side. Good. All right. Face me over here, left side up. Okay, so this is not her favorite.
No, it is not.
But she does great at it.
Oh,
Bottom leg straight. Look straight up towards ceiling. Deep breath in and exhale out. Relax that upper body. One more. There we go. Other side for me. And Sarah's original plankster, it looks like. That's a solid shirt.
They have some really cool stuff.
Do they really?
They just like hooked us up with some swag. Like we got to pick all this stuff out.
Nice. Breath in, breath out. Relax the upper body, whole way out for me. Look up towards ceiling, right there. One more. Exhale, easy out. Good. Flatten your back for me. All right. Okay. Hands here. We're just going to check this little wrist. And get these guys.
I do this myself all day long.
Yes, yes, yes. Good to move joints, good to move joints. Open hand up. We're going to kind of check shoulder right here. And you're going to press into my hand and stop. Stop, stop pressing. And press. And stop. And press. And stop. And press. And stop. Good. And there. Core's getting better. Been diaphragmatic breathing a little bit, right?
A little bit, yeah. On my drive.
On your drive, right? So she's driving like an hour?
No.
45 minutes?
Half hour now.
Half hour now? little closer.
Yeah.
But you can check out some of the other videos for some of the core work that we do, the diaphragmatic breathing. We've talked to her about rib flare, which rib flare occurs when you don't engage your core and your ribs pop up off your chest. So easy on the left and one more on the right. Good. All right, sit up tall, spin to the left. One more thing we're gonna do, because that right shoulder, left shoulder is moving pretty awesome. Right shoulder's moving really awesome now too, but we're gonna do a little A to P. Good. On the right. Awesome. On the left. All right, so let's see post, come around back. So compared to original, you'll see scapula is a little flatter, spine's much straighter. She's able to sit upright a lot easier than the original. If you zoom back in the video, you'll see. But some things we would continue, and what we're going to continue to work on her, breaking this habit of overuse to the right side of the neck, the left lower back, the left hip, creating symmetry between the upper left, lower right, upper right, lower left, and building that big back strength. Cool? Thank you, Sarah, for being an awesome patient. We'll see you guys on future videos.